Hello all and welcome. My name is Natalie Jensen and I am a Master's of Science candidate in the Family and Human Development Program at Arizona State University. Today we're going to talk about what a child life specialist is, what they do, and why the field of child life is so crucial to any healthcare environment. Um, I should probably preface this with I just got my voice back yesterday morning, so that's why I sound a little hoarse, and please excuse if my voice cuts out a little bit throughout the presentation as, like I said, I just got my voice back yesterday morning. So let's get started. To start, I'd like you to recall a time in your life where you experienced being in the hospital for a minor procedure that went well. And if you do not have a personal experience of this, then think of someone close to you who has experienced being in the hospital. And if that doesn't work, then let's use that imagination of yours and imagine what you think it would be like to be in the hospital. So I'll give you a few seconds here to do that. And if you need more time, then go ahead and pause the presentation and pick it back up when you're ready. So now that you have that memory of being in the hospital in your head, I want you to imagine how all those sounds, the beeping, the nurses talking, the monitors going off, the sight of all the medical equipment in the room, the monitors, everything, and the feeling of the equipment being hooked up might look and feel like to a child. So, hospital visits are becoming more and more common in today's society, especially for children. Things like poor nutrition, chronic disease, drug-resistant illnesses, and allergies, to just name a few, all contribute to this rise in child hospital visits. And even though hospital visits are more and more common, hospitals are still oftentimes very scary, stressful, and disruptive for a child's social, emotional, and cognitive development, as well as their immediate well-being. And to compound the issue, most children do not understand why they are in the hospital, and as a result are uncertain and fearful of the doctors, the nurses, and the medical devices that are necessary for their treatment. That is why a child life specialist exists. And a child life specialist is a highly trained professional who has undergone years of schooling, training, and certifications in fields similar to human development and child life. Now, a child life specialist's job is to encourage continued normal development and to be an advocate for patients and their families while in the hospital. So even though child life is incredibly important to a child's hospital experience, there is not enough education surrounding what a child life specialist actually does to support children and their families through these potentially traumatic and disruptive events. As it stands now, there's a divide between some of the members of the medical team who do understand and recognize what a child life specialist does, and the other half who is uncertain and wary and maybe doesn't fully understand their role and the necessity that they bring to the medical team. So why is child life necessary? Where did this come from? The child life profession was born out of the necessity to help children and families who must undergo medical treatments face the unfamiliar, scary, and stressful environments associated with being in the hospital. The reality is that the majority of children do not understand why they are in the hospital or the treatments they will receive. And to add to that, a lot of their parents are unsure how to explain it all to their child. For example, inserting an IV can be a traumatic experience for a child, especially if she or he does not understand what is happening or the necessity behind it. A trained child life specialist can perform this function as well as reassuring the child that during the procedure they are okay, they are safe, and that they have someone on their side. And in doing so, this reduces the stress on the child and the parent alike. Many times, even if parents could or wanted to explain to their child what's going on, the child would still be frightened and uncertain. And when you have prolonged situations where a child is frightened, scared, uncertain, mistrusting of their environment around them, the child's development becomes um, threatened. And that's something that a child life specialist wants to avoid. So, in addition to helping a child and their family cope with their medical treatments, a child life specialist is also the family's advocate and liaison to the rest of the medical team. Now, medical staff are fantastic at achieving medical objectives, and they are great at what they do, and their compassion is ever so obvious. Um, Yet sometimes they just cannot address a child's emotional and cognitive and developmental states, um, and provide medical care. So this is why the child life specialist is the link in the chain that allows the child and the family to be as comfortable as possible while easing the stress off of the doctors and nurses so that they can focus on the medical aspects. So we just briefly touched on the benefit a child life specialist may have in terms of calming down a child and working with parents to help them understand what's going on for their child. But what does a child life specialist really do? How do they achieve their goals? So the main role of a child life specialist is to focus on a child's physical and emotional strengths in order to promote continued normal and optimal development, all while attempting to lessen the negative outcomes associated with hospitals and the stressful situations that hospitals can bring. So in order to achieve this, a child life specialist utilizes age-appropriate interventions to, first one's encourage development. Development continues even in hospitals. In fact, development continues everywhere we are. And extended hospital stays can cause regression, developmental delays, and even cognitive delays. So it's really crucial that the child life specialist works with these children to help keep them on track developmentally, to make sure that they are hitting their markers in development. The second thing a child life specialist does is they communicate medical information. They help the parent and the child understand what is going on, why it's necessary, and that it's okay. Doctors and nurses are fantastic at communicating medical terms in a medical jargon sort of way. Yet sometimes maybe the relationship is lacking between the parent and the doctor, or the nurse and the parent. So the child life specialist gets to step in and really listen and hear the parents' and child's concerns and needs, and then helps them understand in layman's terms what's going on. And then on the flip side of that, they can step back and go to the medical team and say, here is what the child is feeling. Here's what the family is feeling. How can we address that in a medical way so that they feel heard and safe by you guys? The third thing a child life specialist does is they help develop and implement coping strategies. New experiences, even for adults, can be stressful and scary. And the best way for anyone to deal with these are to develop positive coping strategies. So a child life specialist will work with the child and the family to figure out the best way for the child to cope with what's happening to them. And once they help them create coping strategies and kind of throughout the whole process, a child life specialist will help the child address all the feelings about their past and future experiences. And they help the child work through their emotions. For example, say a child had a traumatic experience with an IV insertion upon their last visit, and they have to get an IV this time, and they're really terrified of the needle and what's going on. The child life specialist will work with them to move through the past experience and address their feelings in relationship to where they're at now and where they were in the past, and how to move through them so that they can get through the treatment as easily as possible. And one of the most important things that a child life specialist does is they establish family-centered care. And this is a therapeutic model because when a child's in the hospital, it's not just the child that's in the hospital. The entire family is. And the entire family is experiencing what their child is going through. Their routines are changed. Mom and dad have to take time off of work. Siblings may or may not understand what's going on. Why is my brother or sister here? Why is grandma picking me up from school instead of mom and dad? So all these things affect not just the child in the hospital, but they affect the family as a whole. So the child life specialist looks at the family unit and understands where they need support, and they help them move through that and get the support that they need. Now, this is not an exhaustive list of everything a child life specialist does. It's just it is a pretty comprehensive list of what they do on a day-to-day basis and the main roles and goals that they have when working with their patients. So, are child life specialists really, really effective? Well, yes, they are. Studies have shown that children who receive the interventions of a child life specialist while in the hospital have fewer post-op complications and recover quicker than those children who did not receive any child life services. In addition, those who did receive the services did not need as much pain medicine and had their hospital stay shortened. Parents also reported higher satisfaction with the hospital and their child's treatment when they received the services of a child life specialist. So overall, a child life specialist adds a lot to the patient and the family's experience of the medical treatments. They have a very positive role in what happens in the hospital. So what is a child life specialist's role within the medical team? We just saw that a child life specialist has a big impact on how well a child can recover from surgery, how they can affect their emotional states. But what is their role within a medical team? Now, as I mentioned, child life specialists are highly trained individuals who have gone through many years of schooling and training and certifications in order to work with children in such a capacity. Yet it's important to point out that the majority of child life specialists have no formal medical education. They're not doctors, they're not nurses. But these child life specialists play a role in the overall mental and physical well-being of their patient. They just don't, unfortunately, have a lot of power within the healthcare unit. They are an important part of the team. There's just no power in the healthcare unit. Now, this is because a majority of the doctors and nurses really do not fully understand the benefit and the services a child life specialist brings to the table. In a study done by the Child Life Council, when medical staff were asked to rate the services of a child life specialist, the medical staff rated them a third out of 5 of the most important member of the team with regards to overall mental and physical well-being. Surprisingly, those same doctors and nurses were unable to actually describe what a child life specialist's role was. They had no clue what they did. To these medical staff, a child life specialist was there to provide entertainment for their patients and keep them occupied until the doctors and nurses were ready for them. Now, let's talk about that for a minute, because in a way, that is accurate. Child life specialists do use distraction and intervention techniques while patients are waiting for their treatments, yet they do so much more beyond just distraction. As we just talked about, they use developmentally appropriate interventions to help the child cope with their time in the hospital and their treatments. For example, if a child's never had an IV before and they're going to have surgery, a child life specialist, for example, may use a bear that has an IV, a stuffed bear that has an IV inserted in its arm. And they may bring the bear to the child and talk about, oh, this is my bear, and see he has something stuck in his arm. That, it's just thin plastic, and this helps deliver really good medicine that will make you feel better. And it's nothing to be scared of. It's just a little thing that goes in your arm and will help you feel better. And then they let the child play with it and familiarize themselves with what that looks like. And then they talk about how that's going to be in their arm, and that's what that's going to look like to them. So Child Life gets to go in and work with the patients and their families in this kind of capacity, but many doctors and nurses fail to see the benefit of utilizing a Child Life specialist because doctors and nurses come and go. They're not always with the child. They don't track the patient's cognitive and developmental markers as they're in the hospital. And so as a result, many doctors and nurses that do not understand the benefit of a Child Life specialist really rely on medicines and traditional techniques to help get them through their medical treatments. Now, this discrepancy in the perceived role of a Child Life specialist and their actual role is alarming. And this lack of knowledge about what a Child Life specialist does really can and does hinder their ability to perform their job effectively within the medical unit. So by now we've seen just how important a Child Life specialist's role is, encouraging healing and development, and the benefits they have for the medical team and the hospital itself. But who picks up the tab for the services of a Child Life specialist? Well, in fact, it's the hospital. Most hospitals do not bill for the services of a Child Life specialist. It's something that they take on themselves. They recognize the necessity for the Child Life specialist, so they incur the expense. And there are some hospitals throughout the country who are starting to bill the insurance companies for the Child Life expenses. This is not the norm. I would imagine somewhere down the line, according to the research that I've seen, that this will become the norm down the line, but right now it's just an expense the hospital takes. So since the hospital pays the bill for the Child Life services, many hospitals see Child Life programs as expendable because they're just not a revenue generating department. Yet, interestingly, studies done by the American Academy for Pediatrics show that a Child Life specialist can actually reduce the amount of pain meds needed and anesthesia a patient needs, and that they can also reduce surgery complications and post-op complications. And in some cases, they can even decrease the length of stay for the patients. So when you think about it, the Child Life specialist really is saving the hospital money on overhead costs in terms of pain meds and anesthesia. So employing a Child Life specialist is good for business. It's good for the hospital, it's good for the families, it's good for the patients. Yet most hospitals just really don't see how much of an asset these Child Life specialists are. Now, we've mentioned that a Child Life program is effective at saving the hospital money every year, but in a larger scale and a bigger picture, the amount of money that a Child Life program can save the hospital is relatively small compared to the overall operating budget of a hospital and the actual expense of employing a Child Life program throughout the hospital. So these savings are good, they're great. Hospitals see them, they just don't affect the bottom line as much as the hospitals think they should, for hospitals to really fully recognize and understand what it is, why they're necessary. So if Child Life programs and Child Life specialists are funded by the hospital and yet not always understood by their medical counterparts and, say, even hospital directors, why can't the doctors and nurses just do the job of a Child Life specialist? We've talked about how a Child Life specialist is a highly trained professional and is equipped to deal with the emotional and cognitive and developmental needs of patients and their families. But they're not medical personnel. And on the flip side of that, medical personnel are not trained in therapy and analytics in terms of how our brains work. We all know that medical personnel are responsible for evaluating and treating children who are sick and traumatized and even mistreated. So medical personnel must be able to provide treatment quickly and accurately while attempting to keep the children and family calm. Well, this is no easy task, especially if you have more than one patient and you do not have a lot of time with each patient individually. Many times the medical staff just cannot do both. They cannot provide quality medical care and cognitive support, emotional support, and developmental interventions, all while being an advocate for their family and administering medications and charting and doing all the things in their job description. Either they just do not have enough time or the manpower, or they really fully do not understand what the child needs emotionally, cognitively, or developmentally in that moment in order to reduce stress and encourage the child's coping skills. So as a result, the patient could be at risk for unnecessary emotional, cognitive, and even developmental suffering because they did not receive the best quality care they could have. The bottom line is doctors and nurses simply just do not have enough time to do multiple jobs. Because as it stands now, medical units are already maxed out in their own specific medical duties. And this added challenge for them to provide developmentally appropriate communication and intervention and advocacy for their patients and their families just really is unrealistic. There's no time. And unfortunately, this system is common practice. And it just doesn't work as effectively or efficiently as it could. Now, pretty much all pediatric specialty hospitals utilize a child life program very successfully. And yet many hospitals that are not considered a pediatric specialty either do not employ a child life program, or if they do, the child life program is on a much smaller scale and contained to specific zones in the hospital, mainly places like inpatient pediatric services. So when you have a child life in the hospital, how do you decide who gets the services of a child life specialist? Now, I think it's important to kind of talk about ratios for a second. Every time you're dealing with a child, there are rules and regulations surrounding how many children can be assigned to an adult, and that fluctuates and changes as the children get older. And then you have to, and in a medical situation, you have to factor in developmental age as well as physical age into this ratio. So in terms of ratios, per the Child Life Council, which is the governing board for anything child life related across the country, the prescribed child life specialist to patient ratio is one child life specialist to every 15 patients. Unfortunately, because there are not a lot of child life specialists and there's a greater need for them, the actual ratio ends up being one child life specialist to every 30 patients on an average basis. This overloading of patients to the child life specialist really hinders their ability to be effective, and it forces the child life specialist to have to choose and prioritize which patients need their services more. Now, this is troubling because research shows that receiving the services of a child life specialist really reduces the amount of anesthesia and pain meds needed, and it can reduce pre- and post-op complications, and it can even reduce a child's length of stay in the hospital. So if the child life specialist is overloaded and they have to choose which children they see, then every child that comes through the hospital doors is not getting the benefit of the child life program that the hospitals are paying to provide for their patrons. This is a problem. And in fact, the Child Life Council has actually recognized this, and they are currently conducting a research study with select children's hospitals, and Phoenix Children's Hospital is actually partaking in this study. And they have certain child life specialists who they've asked to track how many patients they see a day, how many hours they work a day, and how many patients they were supposed to see per day. Meaning, who was on the roster on your floor, how many hours did you work, and in reality, how many patients did you see? And then they average that out to see how many patients a child life specialist on the particular floors are seeing per day. And this is in an attempt to rework these ratios because these numbers are double what they should be. And it really is keeping the child life specialists from being as effective as possible. They are often needed more than they can give. And this really goes back to being an issue of not giving the best quality care possible. So, what can be done to fix this? We've talked about how the Child Life Council recognizes that there is an issue in terms of ratios of patients to child life specialists. So I would imagine somewhere down the line we will see an alteration in the ratio numbers. But what about education? This breakdown in the perceived role of a child life specialist and the rest of the medical staff really is a big indicator that there needs to be more education surrounding child life and the pivotal role that they play in the medical team, in the hospital, and in the family and patient's overall emotional and physical well-being. Through daily interactions, one would think that exposure to a child life specialist and the work they do would be some sort of education or a clue to what they do and the benefits they have. However, this does happen to an extent, and some people and some medical personnel do pick up on all the good and positive things that a child life specialist does. But beyond daily interactions, there is a greater need for education about the services of child life. Many hospitals, and especially teaching hospitals, give seminars. Some give them quarterly, some give them annually, some biannually on select topics that are predetermined, and then these seminars are attended by hospital staff. This would be a fantastic way for medical personnel to really learn and be educated on the important role that a child life specialist plays for the family and the child. But also, it's a great opportunity for medical personnel to learn how a child life specialist makes their job easier. Now, all of this will take planning and time, and the logistics and planning will have to be done by the Child Life Program Director and the hospital directors, as well as those in charge of education. And these seminars should at least be given by a child life specialist at least once a year to really make sure that we're staying current on what child life does in the hospital and the services they provide. And the seminar should also include current research trends in the field of child life and ongoing developments in the child life field. Things like the ratio study, new treatments. Phoenix Children's is also doing a virtual reality study to help children. They're going to measure virtual reality goggles to see how children react to virtual reality going back into surgery rooms. So things like that to keep doctors and the medical staff in the loop about what this exciting field of child life is bringing to the table. So once we clarify education and we really have a solid understanding of what a child life specialist does, this will allow for the child life specialist to begin to bridge the gap between their perceived role and their actual role. And in doing so, the child life specialist will be able to really fully assimilate into his or her place as an integral component of quality-based pediatric medical care. Now, life continues regardless of if one is in the hospital, and the children and families who face hospitalization need an advocate and a trusted face in an oftentimes stressful and uncertain environment. Once the role of a child life specialist is understood, valued, and respected, this crucial and important field can continue to grow and develop so that it can provide patients and their families with a better and more effective service. Thank you very much, and I hope you guys enjoyed learning all about what a child life program looks like and all the benefits that they provide to children and families.